Ladies and gentlemen, please welcome your conference chair, Anita, Anand.
Well, hello, and welcome to this NHS Confederation conference. My name is Anita, Anand. It is a very great pleasure to be with you again this year. And I really mean that genuinely. This conference, and I cannot believe it's been a year. Has it really been a year, or is this a massive practical joke? It's gone so fast. But the NHS Confederation conference is truly one of the highlights in my calendar, because I've never been to one of these where I haven't left inspired by some of the people that I've heard speaking, and I haven't left with wheelbarrows full of new information that I had no idea about. So it is a pleasure to be here. It's also lovely to see so many familiar faces here. If you're a veteran of these campaigns, welcome back. There are also some fresh faces here as well. If it's your first time, an even bigger welcome to you. I'm just so very sorry that you chose this year to come when we've got so little to talk about. Actually, I can think of 22 billion things we can be talking about. I did a quick survey just of the last 2 weeks of headlines pertaining to the NHS and things that you might be slightly interested in. So what do we have? Well, of course, we have that black hole in finances, which keeps sucking in headlines. We've got that still visible mushroom cloud hanging over the junior doctor's dispute with the Secretary of State. What else do we have? Oh, just 24 hours ago, the head of the Society for Acute Medicine saying that the NHS does not work in its present form. And you may have missed this only a few hours ago in the wee small hours of the morning. An editorial from the BMJ, the British Medical Journal, well, venturing into that terrain which people are really rather frightened of venturing into at the moment for good reason. Brexit. Yes, your world, the NHS, has become a battleground for innies and outies. And the BMJ editorial, Fiona Godley, has compared those who are lobbying for an exit to anti-vaxxers who would like to visit pestilence upon the most. I don't know if that was a sneeze or a guffaw, bless you, or you can raise a question later. But yes, so this is a really sort of febrile moment in the history of the NHS. And I sort of feel like the times that I've hosted this conference before, we've been in that sort of thinking mode. It's that blue sky period where people were talking about 5-year forward plans, strategies, reform. It was the talking the talk phase, if you like. This year, when I look at the excellent plenaries that have been planned for you, and I see the speakers that the NHS Confederation has booked for you, I am struck by how we are now very much in the walking the walk phase. This is all about implementation. This is all about people who are doing the jobs that we have spoken about for the last 2 years. So it is a very exciting time. And things have changed from last year. The pace of change is breathtaking. Do you all remember the boy band from last year? Well, yes, I don't know what you said, but it was hilarious. Okay, yes, we had a number of stalls here with the big beasts of the NHS sitting here. We've lost 2 members of that band. The TDA and Monitor, as you know, have been merged into this one super entity. We'll be hearing from the new lead singer, if you like. Jim Mackey is going to be addressing conference this year. And we also have the Secretary of State who's going to be speaking to you. We are going to have Simon Stevens of NHS England. And we are going to be having the freshest face in the big beast compartment, and that is your new interim NHS Chief Executive. Please put your hands together for a man who everyone tells me is a ferocious, straight talker. Please welcome to this stage, Stephen Dalton.
Thank you very much. Welcome to Manchester. And welcome to 3 days of debate, decision-making, learning, sharing, hard work, and a little fun too, and it seems like much of it might be at my expense. So 2 messages to 2 tweeters before we start. Andy Cowper, I am not your Dolly Parton. And to Sean Linton, don't start yet, it's only day 1. So it's great that you could all join me, and it's great that you could all join me at this, my anniversary event, yes. You're right, I am old. It's 40 years since this week since I joined the NHS. And I know what you're thinking. You know, did the NHS rely on child labour then? Yes, they did. So for me, it started a lifelong love affair with the NHS, which I haven't tired of. And if you think a world without emails and mobile phones must have been so very different, well, in some ways it was different. The summer of '76, it was the hottest on record with average temperatures of 30 degrees. And I live in Cumbria now. I didn't then, but in Cumbria then there was 45 days without rain. There's some weeks in Cumbria when we don't have 45 minutes without rain, actually. But 40 years ago, there was remarkable similarities too. The NHS was getting over a bitter dispute with junior doctors who took industrial action over new contracts. And the year before, the government held an in-out vote on Europe, with 67% of voters actually voting to stay in Europe. So we've managed to be at the conference 10 minutes, and we've mentioned Europe twice now. Also in 1976, the then Secretary of State for Health, Barbara Castle, launched a consultation paper which called for the NHS to shift away from a focus on hospital-based treatment to primary and community care. Particularly for the elderly and those living with long-term conditions, it also called for a closer alignment of health and social care. Indeed, the paper was called Priorities for Health and Social Care. Perhaps a catchier title might have been The 40-Year Forward View. Don't tell Simon Stevens I said that. He's going to get really upset because he's only got 4 years left. So, enough of all this ancient history anyway. Let's talk about right now. We haven't got 40 years to talk about change, and we certainly probably haven't got 40 months. I believe we do have a consensus that the way forward for the NHS won't be found in leaders of the NHS circling the wagons and launching another sterile internal debate about who's to blame, or believing that the magic bullet is simply more money. Yes, I know we need more money, but it's not a magic bullet. Money won't get us out of our silos. It won't necessarily help us see that those who need our services are complex. In responding to the needs of our communities, we have to ask if we truly have an offer that takes account of individuals' physical and mental health needs. Do we have an offer that is designed in partnership with those who can influence the wider determinants of health? Are we ever going to get serious about prevention? And are we prepared to cede organisational sovereignty and the proprietorial nature of how we own patients and people who need our help? That's why today, in partnership with the Local Governments Association, Directors of Adult Social Services and the NHS Clinical Commissioners, we're launching this paper, which you'll see around the conference. It's a document worth a read. It's not another 40-year forward view, I promise you. This is an important contribution, and it will be a theme throughout the conference. So, we've got a great conference and a great 3 days lined up, and I'm going to get off in a moment so that we can get on with it. Before I go, I just want to return to talking about you and this, the largest annual gathering of leaders. And I want to say hello to a couple of new chief executives. I want to say hello to Dr. Navina Evans. She's the new chief executive of East London NHS Foundation Trust, a doctor by background, and takes over in July from Robert Dalton, who for 10 years has led this really brilliant organisation. And I want to say hello to Dr. Sarah Munro, a nurse by background, who in September is taking the lead at another great organisation, Leeds and York Partnership Trust. And why am I saying hello just to these two new chief executives? Well, these and other new chief executives, because they're representative of the future of the NHS leadership. And at this conference should be all about the future, about being optimistic, and about looking ahead. And the other reason I'm saying hello is because they don't look like me. So, if you haven't been around forever like me, if you don't share my ethnic background, if you don't share my sexual orientation, and if you're not male, let me send you a very clear message. You look like the future of the NHS leadership. And to all the white heterosexual males who are aspiring leaders, I want to say to you, don't worry. There's room for you too. It's just that your place in the queue isn't as secure as it used to be. So, I'm the interim chief executive of your NHS Confederation, Asked for how long, apparently I told the HSJ I was hoping for a quiet Christmas, but with my chair we'll see. It is a privilege, and in my time in the role I'll be ensuring that the Confed remains focused on your priorities. The lifeblood of the Confed is the membership. Front and centre of what we do are the networked organisations. These are not some satellites of some Confed mothership, but are the essential components that make up the Confederation of Partners. NHS Clinical Commissioners, NHS Partners, Mental Health Network, our links with ambulance trusts, community providers, our representatives in Wales and Northern Ireland, and our associate members. The landscape, your landscape, our members' landscape, the place where you operate is changing, and your representative body needs to change too, and we'll be talking more about that. And my job, in my interim time in this role, will be to make sure that that change is delivered. Finally, it would be remiss of me if I didn't say a few thank yous. I particularly want to thank Danny Mortimer and his team at NHS Employers. It's been a busy year, and perhaps I should say no more. I also want to remind everyone that we have a European office, and thank them too. I'm guessing Elisabetta, who leads that for us, is going to be up all night on Thursday. And a big thanks to our hard-working Confed staff who've put together this lively 3 days. Before I go, I want to record my personal thanks to Rob Webster. He did a great job for the members, and he did a great job for the Confed. It's now my great privilege to introduce an individual who, on behalf of our members, can exercise the political reach and access that you require. His wealth of experience and understanding of health policy marks him out as the leader who we need right now. Former Secretary of State for Health, he was the first elected chair of the Health Select Committee, a position he held from 2010 to 2014, and he was a parliamentarian for 36 years. In a very short time, as chair of the NHS Confederation, he's brought a transformative and collegiate style of leadership to the organisation, which is very, very welcome, and mirrors what is needed from the leadership of the health and care system in this country. On a personal note, I'm thoroughly enjoying working with him, and he's a great chair to have. Please welcome the Right Honourable Stephen Dorrell.